Hello, good morning once again. This is Dr. Dennis Latuno. Today I'll be talking about or blogging about coronary artery disease, also known as ischemic heart disease, in layman's term, heart attack. But before I start my vlog, I would like to tell you another dad joke, but maybe most of you know about this already. So here it goes. Why is 6 afraid of 7? Answer is because 7, 8, 9. Anyway, we'll start with ischemic heart disease or coronary artery disease / heart attack. Actually, it's the leading cause of death worldwide in census in 2019. And ischemic heart disease or coronary artery disease means there's atherosclerosis in the coronary artery. Atherosclerosis means that there's a buildup of cholesterol plaque that can narrow or even totally block the artery supplying the heart. So, risk factor for coronary artery disease or heart attack are smoking. So if you're smoking, stop smoking. Overweight or obesity, family history. If any member of your family, especially immediate family, parents or sibling, died of heart attack, less than 60 is considered a risk factor. Hypertension is a risk factor, high cholesterol, and diabetes. Yeah, there's two kinds of presentation of heart attack, meaning the typical chest pain and the atypical chest pain. Typical chest pain usually is a pressure or heaviness in your chest, either in the middle or the left side. And usually the pain or numbness radiates to your arm, to the neck, or the back. And usually it's associated with sweating and sometimes shortness of breath. And then atypical presentation is common among diabetics, the elderly, and women. Usually they present like just lightheadedness, shortness of breath, sometimes just bilateral shoulder pain or nausea. And majority of them sometimes don't even have chest pain. So heart attack or acute coronary syndrome in the medical term, there's two types, type 1 and type 2. Type 1 is divided into the ST elevation MI and the non-ST elevation MI. Meaning if you do an EKG on a patient with having chest pain, if you do an EKG, there will be elevation of the segment called ST or a depression in the non-ST. You diagnose it by clinical presentation, the typical or atypical chest pain, and then you do the EKG, and then you do the blood tests called troponin. Troponin are actually protein in the muscles of the heart, and if the muscle of the heart is like damaged, it's spilled into the bloodstream. And then there's type 2 MI or heart attack, which is secondary to a demand ischemia. Usually it's caused by an acute or chronic underlying medical condition, and some of the examples are congestive heart failure, fast heart rate like atrial fibrillation, flutter, if your blood pressure is not controlled, if you have a kidney failure, you have severe anemia or severe infection like sepsis, COPD, and there's so many others. To treat the type 2, is actually you treat the underlying medical condition. So treatment for acute coronary syndrome, initially when they present to the emergency room, you give them aspirin right away, 325 milligram times 1 now, and then after that 81 milligram daily. Give them oxygen, beta blocker, and then you give them either heparin or heparin or Lovenox, and then you give them Plavix or Brilinta, and then morphine for pain, and then of course you give them high dose cholesterol medication or statin. And if the patient had the ST elevation MI called STEMI diagnosed right away, you need to call the cardiology right away on call so that they can do a cardiac cath right away to see the anatomy of the coronary arteries, if there's block or blood clot. And if there is, they will do procedure called PCI, which is percutaneous intervention. They either put a stent or do a angioplasty. Prevention of ischemic heart disease. Usually, if you're a smoker, of course, you stop smoking. You need to eat healthy food, avoid fatty foods, fried foods. And then you need to exercise at least 30 to 45 minutes a day, 3 times a week to start. And then you gradually increase your exercise tolerance. Of course, if you have high cholesterol, you need to lower your cholesterol through combination of statins, sometimes fibrates. And if you're overweight, of course, you need to lose weight. And if you have high blood pressure, you need to control your blood pressure properly. So that's it, folks. It's short, but I hope you learned from my latest blog. And again, subscribe and like. And I will see you again next time. Again, Dr. Latuno. Bye for now.